one of my favorites. It's the best. Okay, this particular adjustment is called the anterior thoracic. And the anterior thoracic is specific for flexion fixations from about T3 to about T10. T3 to about T10. Although we can probably go T11 and T12 as well with modification. So, to remind you guys what flexion fixation means, can I have somebody here to assist me in the demonstration of... Okay, thanks. Mind sitting here again? And you're going to cross your arms for me. Okay, great. So I like it how it's on the scapula, but just remember if your patient's not on the scapula, you can always move their arms until they are. Okay, so I'm going to start at T3, although of course in assessing the entire spine you would again start at the top and work your way down and not stop in one location and adjust it. So just to remind you what this is all about, you get your finger in the interspace from one spinous process and the other. You will bend your patient forward, and as you bend your patient forward, what should happen is upon bending forward, the top spinous process moves anteriorly, and then as a result, you will feel a widening or a gap underneath your finger as you flex your patient forward. Okay, then there comes a point, so of course you're going all the way down. Then there comes a point where it feels like when you bend your patient forward, instead of that nice open where the top one moves anterior, instead it doesn't. It doesn't move anterior. So the idea is that we are going to try to open up this space. So this is called a flexion fixation. We're going to try to open up this flexion fixation using a lever. Either this part of our thumb, or this part of our hand, or we can also do this part of our thumb, or this part of our hand. But whatever it is that we're using, we are going to be using this flat surface to eventually jimmy open that space. Does that make sense? Yes? I haven't lost anybody so far. Okay, cool. Okay, so the whole idea with any adjustment, you can just uncross. The whole idea with any adjustment is to try to move the spinal segment in that motion as much as possible. Take out full what is called joint slack, where you've opened that space as much as possible within its physiological range of motion before you give it the little impetus to keep it there. So in a flexion fixation, what we need to do is we need to flex that segment as much as possible before we give it that little flexion impulse to keep it there. Okay. Now, you're probably going to have to drop that for a second because I'm going to do an exercise.
Yeah.